We are live. We are live. Welcome to Medical Monday. I'm Dr. Frita, and I have a jam-packed show for you. Today, we are talking about celebrity health, of course, and all of the hot health topics in the headlines. We'll start off with my favorite game, Myth versus Fact, because it's Breast Cancer Awareness Month. Y'all like my pink? That's all right. Listen, honey, it's Breast Cancer Awareness Month, and so we'll definitely talk about that through a game of Myth versus Fact, with some oftentimes confused information about breast cancer. And then we'll move into the weekly dose, where I'll give you a fresh take on medicine in the headlines you simply can't get anywhere else. We'll open up talking about body lice, okay? Because there's been a body lice outbreak on a university campus. And the number one way to prevent body lice is to take a bath. Yeah, personal hygiene. So we'll talk about that, and then I'll get into the details of what body lice are, how to prevent them, and what to do, and what to tell people if they're not taking a bath. Oh my goodness. And then we'll talk about Madonna, the material girl, because she is coming forth and sharing out of her own mouth, with her own words, her experience with sepsis. So we'll talk about sepsis versus septic shock, signs, symptoms, what to do to watch out for it, and what to do if you develop any of these signs or symptoms. Next, we will talk about, listen, do y'all watch Abbott Elementary? I love that show. My youngest daughter got me watching it. Well, one of its stars, Tyler James Williams, who's also a Golden Globe winner, I believe, has Crohn's disease. And so he's come forth and he's sharing some details about that to raise awareness. And so we'll talk about Crohn's disease and help to raise the awareness as well, of course. And then I'll talk to you about some more recalls. Listen, there has been a Listeria outbreak. At least 4 people are no longer alive due to the Listeria infection, that outbreak. And one lady even lost her baby. She miscarried. And so I'll tell you which foods are being recalled. And so if you shop at Walmart, Trader Joe's, Albertsons, Kroger, then please listen up, because you need to know if you're eating something that's been recalled. Oh my goodness. Next, we'll talk about Terry Crews and how he works out every single day and what he has to say about discipline. I'll see if you agree. Of course, we're live, so I'll be asking you questions. You can ask me questions, and we are going to have a great evidence-based hour with these hot headlines. Welcome to Medical Monday. I'm Dr. Frita. Give us a like as we get started, because you're about to learn in a fun way. Welcome, welcome. I'm Dr. Frita. Welcome to Medical Monday. We're about to get this thing started, but you know I'm not doing it alone. To my office manager and co-host, Miss Shador, would you please come to the front of the stage? How are you doing, Miss Shador?
Hey, pretty good. How are you?
Doing well. How was your weekend?
Weekend was pretty good.
Good. Mine was not relaxing, because my twins, my 9th graders, had their first high school homecoming. They had their first high school. You know what? I'm going to put a couple of photos in my stories. I haven't done it yet, but I'll do it today. So if y'all follow me on IG at Dr.Frita, I'll have some photos of my 15-year-old twins. It was quite the experience. They have 2 separate friend groups, which is good, because I know as twins, you need to be individuals. I know you know that, Shador.
Mm-hmm.
It would be more convenient if they had one friend group, one drop-off time, one set of issues. But yeah, they had a good time. So that was cool. Yep. But, you know, some folks who we're going to talk about today are not having a really good time, but we are going to make it fun like we always do, Shador. And we are going to recognize that October is Breast Cancer Awareness Month. It's Breast Cancer Awareness Month. If you are a breast cancer survivor, or if you have a loved one who is a breast cancer survivor, please put pink hearts in the chat. And Shador, who was the first person in our chat today?
First person today is Miss Marina. She says, good morning, Dr. Frita and Shador. Thank you for the video on Listeria.
Oh, you saw it. Oh, okay. So we're going to talk about that. And I can't wait to find out, because those are really popular shopping places, right? I know I shop there, and my daughter loves some of these foods that have been recalled. So we'll talk about what to do. So stay tuned for that. And you're welcome for that video. And for my members, the full video is available to members only. But what I did is, after I filmed my members only video, I went and kind of edit it in a short form to share it with other people. Because as I was talking, I'm like, wait a minute, more people need to know about this outbreak. So thank you for that feedback. All right, let's get started with my favorite little game, myth versus fact, breast cancer edition. All right, let's first play the clip, and then we'll get into myth versus fact.
All right. One second, a lot of clips, Dr. Frita.
I know it's a lot of clips. Let's see. Or we'll go ahead and get started and do the clip after, shall we?
I got it. Here we go.
Okay.
This year marks 40 years of Breast Cancer Awareness Month. Over the last 4 decades, something incredible happened. The breast cancer death rate in the United States dropped 44%. That progress isn't a coincidence. It happened through increased early detection, through advancements in treatment, through improved access to quality care, and through millions of people helping women now. At National Breast Cancer Foundation, every moment is an opportunity to help, and now is the most powerful moment we have. This October, you can help women get screened, navigate care, feel supported, find hope. Now. Helping women now means taking action today. What will you do with your now?
I love it. Yes, the breast cancer death rate has dropped by 44%, and that's remarkable. And of course, we know it's due to increased awareness, increased screening, better treatments. At the risk of being a fun snatcher, though, if you are a Black woman listening to the sound of my voice, do understand that Black women are still 40% more likely to die from breast cancer as compared to white women. And Black women are diagnosed with breast cancer at earlier ages with more aggressive forms of breast cancer, more difficult to treat forms of breast cancer. And so I don't want anybody to sit back and cross their legs and paint their nails as if the battle is over. Make sure you consult with your doctor about what is right for you when it comes to breast cancer screening. So let's get started with myth versus fact. All right, Shador, what's our statement number 1?
Yes, ma'am. Statement number 1. If you have no family history of breast cancer, your risk is very low, so screening isn't as important.
All right, put an M1 if that's a myth, put an F1 if that's a fact. If you have no family history, your chances are really, really low, and so the screening is not really important for you if you have no family history. M1 if that's a myth, F1 if that's a fact. All right, statement number 2, please.
A lump is the only symptom of breast cancer.
All right. I know we've talked over the years about feeling your breast for breast lumps or having your doctor examine you and they might find a lump, which could be suspicious for breast cancer. So is a lump the only kind of warning sign of breast cancer? Put an M2 if that's a myth. Put an F2 if, yeah, that's a fact. It's just about the lump. All right. Statement number 3.
Untreated fever during pregnancy. Oh, what am I saying? Wrong statement. I'll read this one. Statement number 3. Is that correct? No.
Is it it's a Beyonce one.
Both of Beyonce's parents, Matthew and Tina Knowles, have battled breast cancer. My apologies.
Okay. Oh, no. So both of Beyonce's parents, both Miss Tina Knowles and Matthew Knowles, have had diagnoses of breast cancer. Both the man and the woman, the mother and the father. Is that true? Put an M3 if it's a myth. Put an F3 if it's a fact that both of Beyonce's parents have battled breast cancer. M3 if that's a myth. F3 if that's a fact. Jack. Pencils down. All right. Myth versus fact. Breast Cancer Awareness Edition. Do we have any takers for statement number 1, Shador?
Absolutely, Dr. Frita. I don't think you threw any curveballs today. We'll see.
What?
Statement 1. If you have no family history of breast cancer, your risk is very low, so screening isn't as important. So we have, I can see clearly.
I can see.
It is a myth.
A myth. So even without family history, screening is important. All right, I can see clearly.
Donna, hello, says myth.
Hi, Donna. All right.
Anton says a myth.
Hey, Anton, welcome back. All my regulars.
Sheree, also a regular, says it's a myth.
Hey, Sheree, you think it's a myth? Okay.
Purple Onion agrees.
All right, Purple Onion.
Over on IG,
Hey, welcome, IG.
Rainy Girl says a myth.
Rainy Girl says it's a myth. Rainy Girl on IG, please make sure you check out the shorts. I was talking about a lot this weekend. So yes, I did a Listeria short, as we talked about, because there's a Listeria outbreak. I did a short on a body lice outbreak. I did that one just last night, and already it's picked up a lot of traction. So we'll talk about that. And I did some other things. I clipped from another platform where I do lives on medical mornings. Follow me on all my platforms to know what I'm up to. So I did a clip on that where I was talking about how to lower blood pressure naturally. So I got a lot of little special things for y'all over there on IG. And remember, I have different content on different platforms. So welcome from IG. All right. So you say it's a myth.
Yes. And CD from IG says myth as well.
Hi, Stevie. Welcome from IG. Did anyone say it's a fact?
No, I didn't see any facts on this one, Dr. Frita.
All right, all y'all line up and come to the front of the stage. Y'all med heads are just getting too smart for me. I don't know what to do. Y'all know I like to trick y'all with my little game, myth versus fact. But yeah, it's a myth. It's a myth. And so I'm really excited that all of you knew that answer, because for years, even when I started practicing medicine, some people thought, hey, breast cancer doesn't run in my family, so they're not talking to me. Get somebody else to do it. But honestly, by some statistics, up to 85% of women who are diagnosed with breast cancer have no family history. Okay. So not having a family history does not mean that you are at low risk. Now, of course, if you have a family history, certainly if you have genetic markers, that puts you at an even higher risk, but not having a family history does not put you at low risk. So still consult with your doctor. So for women, and it's going to vary because even some of the various health organizations have different nuanced recommendations, but certainly by no later than the age of 40, I recommend that you have the conversation with your doctor about breast cancer screening, and even the conversation about it by the age of 18. Because if you have a strong family history, then it's recommended that you get screened even earlier. For example, if you have a mother or a sister, a first degree relative who was diagnosed with breast cancer by the age of 45, for example, then it's highly recommended that you be screened 10 years prior to that age. So no later than the age of 35. And certainly if breast cancer runs in your family and you have like the BRCA2 gene or one of the genetic genes that predisposes you to kidney to, y'all know I'm a kidney doctor, kidneys on the brain. If you have one of the genetic mutations that predisposes you to breast cancer, then an earlier diagnosis. So all women by the age of 18 have the conversation, but certainly by the age of 40, it's recommended that you have your breast cancer screening. The mammograms and even the 3D mammograms are more sensitive as far as picking up breast cancer lesions. All right, let's do myth versus fact statement number 2, please.
Okay, quick question, Dr. Frita, before you mentioned the screening. Zeta on IG.
Hi, welcome.
Ask, when did you stop screening?
That's controversial, because you'll have some people who will tell people if they're over 70, they can stop screening. If they have, certain consecutive negative mammograms, they can stop screening. But that's actually a very individualized decision, okay? Because, and I'll just give you an example for one type of a cancer. This is not breast cancer, but it's related. Just hear me out. My grandfather was diagnosed with prostate cancer in his 70s, okay? No treatment was offered to him because they're like, you're in your 70s, you're old, you probably passed away from heart disease or something else. So no treatment. And they were like, we shouldn't have even screened you. Well, don't you know, over 20 years later, in his 90s, he passed away from prostate cancer. Mm-hmm. And so there are many people who are told, hey, you don't need pap smears at this age. And hey, you don't need breast cancer screening at this age because you're old and you're probably going to pass away. But it's an individual discussion to have with your physician, your risk factors, and it is ultimately your choice. And you can even battle with insurance companies on when to stop breast cancer screening. And I can tell you right now, My mother is in her 70s. Y'all don't tell her I'm telling her age. She's good in her 70s and she still is getting breast cancer screenings.
Right, thank you. All right, statement number 2. Again, a lump is the only symptom of breast cancer.
All right, myth versus fact. And I better be done trip somebody up in here, and I'm sick of this.
Our member, Miss Andrea, hello.
Hello, welcome. Thank you for being a member. Oh, Miss Andrea, I did 2 members only videos for y'all this weekend. I just felt like talking this weekend, so please check those out. All right, what you say? What you say?
She says a myth.
A myth. You don't think lump is the only thing? Okay.
Michelle agrees that it is a myth.
It's a myth. Okay.
Miss Aileen says myth.
Okay.
Mr. says myth as well.
A myth. Okay, little know-it-alls. Okay.
Queen Gina says myth also.
Queen Gina. Now you know that that's just double because queen is queen and Regina means queen. Okay. All right, queen squared. So everybody said it's a myth.
Everybody saying it's a myth.
All right. I tell you what. Before we're going to move on to the next question, but for all of you little know-it-alls who got it right, because yes, it's a myth. A lump is not the only sign of breast cancer. I want y'all to put what some other signs and symptoms of breast cancer might be. Okay, so we know what you're answering. Put a pink heart and put sign, like in all caps, a pink heart and sign, and let me know what you think some other signs and symptoms of breast cancer are. And while y'all are doing that, let's move on to myth versus fact statement number 3.
Both of Beyonce's parents, Matthew and Tina Knowles, have battled breast cancer.
Now, let's see. Do y'all know this answer? I'm about to get up and leave.
T. Chosen, hello, says it is a fact.
Hello, T. Chosen one. You said it's a fact. Her dad is a man. He had breast cancer? Okay, we'll see.
Lisa says a fact.
All right. Hi, Lisa.
H. Jones says a fact.
Hello, H. Jones. But y'all think y'all are something today.
Jetty, hello, agrees.
Hey, Miss Jetty. Miss Jackson, if you're not there. What's Jetty say?
She says a fact.
All right, Jetty.
Queen Gina said myth.
A myth. Okay. So maybe you've heard of one parent having it, but not both of Beyonce's parents. All right. Stay tuned. Stay tuned.
And over on IG, Yola says a fact.
Hola, Yola. All right. You say it's a fact.
And Rainy Girl says a fact as well.
Says the fact. All right. Well, indeed, it is a fact. Can you imagine? Both of her parents, Miss Tina Knowles and Mr. Matthew Knowles. Matthew Knowles was diagnosed in 2019. And Miss Tina Knowles just in 2024. Now, and it's interesting, I was actually on a panel with Mr. Matthew Knowles. It was a panel on rolling out. It's on my social media platforms, definitely on IG, definitely on Facebook. And so I was on a panel with Mr. Matthew Knowles, with T-Boz, and we were just talking about health, and we were talking about health in the Black community specifically. And he was sharing how he first presented with breast cancer. He actually was having like a little kind of reddish brown, kind of a little tiny bloody spot that kept showing up on his white t-shirts. And ultimately he realized it was from discharge from his nipple, and he was diagnosed with breast cancer because yes, men can get breast cancer. While breast cancer occurs in 1 in 8 women, it's much less common in men. It occurs in 1 in every 726 men. But guess what? They can still get it. And so they need to watch out for signs and symptoms, not just lumps, but we'll get into what some of the signs and the symptoms are. For Miss Tina Knowles, she shared that as life was moving and hustling and bustling, she messed around and missed her mammogram. She missed her breast cancer screening. And by the time she got diagnosed, she had stage 1 breast cancer. She had stage 1 breast cancer, and it looks like she's doing well. She's a survivor. But when you think about that, now Solange and Beyonce have 2 parents who've had breast cancer, which statistically speaking will increase their risks. And so they, of course, are going to need to do some really heavy screening. And one thing I want y'all to do, check out, there's a couple people I want you to check out. If you're familiar with Married to Medicine, I know y'all probably see all the drama and all the things that go on. Also, the physicians on that show, and I've had a chance to meet most of them. They are very heavily into health advocacy. And if you check out Dr. Contessa, go to Dr. Contessa's, her information, her IG. She's someone who had a strong family history. Her mother passed away with breast cancer, and she did a prophylactic bilateral mastectomy. She had all of her breast tissue removed. She didn't have a diagnosis of breast cancer. She does not, but she did that very aggressive, way of preventing it. Angelina Jolie did the same thing, had a prophylactic bilateral mastectomy. And so if you are someone with a very strong history, make sure you talk to your physicians about genetic markers, genetic screening, and what possible ways you can prevent cancer. There are different options. And so you want to weigh your pros and your cons. Also check out from Married to Medicine, Dr. Jackie, because she is a 2-time breast cancer survivor. And so she's very active in the breast cancer awareness community, and she's very open with her story. And so I know a lot of times reality shows get bad reps and drama, but those doctors are actually very sharp and very much into the community, and you can learn a lot from their pages. All right, let's play this clip with Miss Tina Knowles, and then I'm going to get back to the question, what are warning signs and symptoms of breast cancer other than just a lump in the breast?
We recently sat down with Tina Knowles last month at her home in Los Angeles, where she opened up about her decision to go public about this diagnosis. Here's part of that conversation.
I was diagnosed with breast cancer in my left breast.
How hard is it to say that?
I'm getting emotional because it was like, I've always tried to take care of myself, and I was in disbelief.
The American Cancer Society recommends a mammogram every 1 to 2 years for women over the age of 55. But Knowles missed hers during the COVID pandemic and forgot to reschedule it until last year. That's when doctors found 2 tumors. One was benign, the other had stage 1 cancer.
It was stage 1, which I thought was the earliest stage. And then when I told my sister, she said, no, actually there's a 0. So if I had gone for my mammogram, I would have got it at the 0 stage. Thank God it was still very small, hadn't spread. It was a very slow spreading cancer.
Knowles had a lumpectomy to remove the cancer from her left breast. Take us to the day of the surgery. Your girls, all of them showed up
All
for
of
you
them showed up
in the hospital
in the
before the
hospital.
surgery. And
Yes,
what did they do?
I was nervous. And so they started just joking with me. And Solange pulls up this video of this young trans woman, and she's saying, I'm very demure and intentional with my, and we're just laughing at
Keep
it.
it
We just
cute.
kept keep
Yes,
it cute.
yes.
And so she's showing me this, and we just look at it.
Right before the surgery?
Right before the surgery. So I start laughing. I get out of my head, and then I said, I'm just so happy that y'all are here. And I thought about the song Walk With Me, which they used to sing all the time. And Michelle wasn't there, but Solange filled in, Angie sung, and they sung Walk With Me. And it's about God walking with you into something and protecting you.
I love Miss Tina Knowles. Y'all can't tell me anything about Miss Tina Knowles. I'm so happy that she's doing well. All right. So, Shador, did anyone in the chat comment on some of the signs and symptoms? Since they were little know-it-alls and they got my myth versus fact questions right, what are some signs and symptoms?
Absolutely chimed in. All right. Miss B Wellness. She says change in size of breast, discharge from breast, and any color changes.
Very good. So change in size of breast, you might get some swelling or edema in one breast, and notice that there are different sizes. And that's normal for one breast to be a little bit bigger than the other. That's normal. But if you notice an appreciable size, that's good. Color changes, like if you get some redness, some erythema on the breast area or on the nipple also. And what else? You said
the changes in color.
Changes in color. Okay. Color changes. That's good. All right. Good. Thank you.
All right. T Chosen.
Hello, T Chosen one.
That's her list. Skin rash, inverted or dented nipples, and pain or discomfort.
Come on to the front of the class. Yes. So you can get skin rashes, and you can even get dimpling in the breast. They call it peau d'orange. Okay. Y'all know what an orange looks like. Y'all, I was raised in Florida. Y'all know what oranges look like, where they have that little kind of dimpled skin, where you can get a dimpled look on the breast. And that could be a warning sign of breast cancer. Inverted nipple is a good one. Now, some people are born with inverted nipples. Okay. Good morning. But if you know good and well that your nipple was not inverted and now you have one nipple that's inverted, there's that nipple change, then that can certainly be a warning sign of breast cancer. And then you can even get changes. You mentioned skin changes, also skin changes on the nipple. You can get like an eczema-like look, an eczematous look, or it might look like alligator skin or get rough. And that can be a warning sign of a type of breast cancer. Very good.
Miss Aileen said swelling under the arm.
Good, Miss Aileen, because your breast tissue is not just in the front where you think about breast. You have breast tissue that extends into your underarm. And so that's very good. When you do your self-breast exams, I know there's been controversy and, oh, how effective, are self-breast exams. Consult with your doctor. I still do self-breast exams and they won't hurt. They might help. But make sure you consult with your doctor and never call yourself doing your breast cancer screening at home. And that's the end all. No, you see your physician regularly. You get your mammograms as recommended. But yes, if you feel a swelling or a lump under your arms, in the underarm area, your axilla, that could be a warning of breast cancer. That's very important. Breast tissue extends to the underarms.
Right. And then Rainy Girl on IG, aggressive itchy skin in the affected area.
That's good. You can get itching skin, just like we're talking about those rashes and the nipples, things of that nature. If you're having this itching, and especially if it's paired with some of these symptoms that we're describing, the dimpling, the swelling, the skin changes, certainly lumps, we do know that lumps can be a sign, then yes, that could be a warning for breast cancer. So bottom line, you want to listen, don't be shy, don't be demure. Look at your breasts in the mirror. Know what your breasts look like. Know if you have any skin changes, dimpling. Anyone else, Shador?
No, that's pretty much
okay.
No.
Very good. Another important warning, discharge. Okay. If you are not a breastfeeding mother and having milk come out of your nipples, then it's abnormal. Okay. So you can have a bloody discharge like Mr. Matthew Knowles had, or you can, even if you have a milky discharge or any kind of discharge and you are not breastfeeding, then you want to check it out because it could be breast cancer. It could be other things also. If you get milky discharge, you could have a prolactinoma, but that's not what we're talking about. If you have a discharge, men and women, and you're not breastfeeding, go see your doctor, okay? Because that could do it as well.
Yeah, all right. I'm sorry, Queen Gina did say discharge. I missed her comment. So
come on to the front. Come on to the front, Queen Gina. Regina, come on to the front of the class. Very good. That's an important one. All right. So make sure you check out my videos here. Oh, for those of you who are new to me, hello. This is the Dr. Frita YouTube channel. Very excited because we are now over 900,000 subscribers. Thank you to all of you for your support. Listen, we have hundreds and hundreds of videos with evidence-based information on this channel. I am Dr. Frita. I'm a medical doctor. I'm an MD. I am board certified in nephrology. So I'm a board certified kidney and high blood pressure doctor. I have also been board certified in internal medicine, pediatrics, and obesity medicine. So I like to talk about a lot. More importantly, I like to share my information, not only through videos, but if you want to have a one-on-one consultation, okay, uno a uno, okay, tú y yo, usted y yo, then I have a telehealth concierge service where I can give you medical information from anywhere in the world. I'm having so much fun. I've talked to people in Paris. I've talked to people in Ireland. I've talked to people from all over, Dubai, you name it. Listen, honey, we can talk
Japan.
about
Yes, on Japan recently, right?
Japan? Yes.
Yeah, Japan. Yeah.
Oh my goodness. So I can talk to you from anywhere in the world, and we can take the full session. I take a full history, and I can give you medical information. All right. And also, of course, we have our members. Thank you, members, where we have a members only live Q&A where all of my members come up. We have a conversation, and I spend the entire time just answering questions, your medical questions about your health, anything that you're curious about. We drop a link. You can come up on stage, and I do members only videos as well. Like I said, I dropped a couple of them over the weekend. I've been talking about some of everything, but definitely sharing medical information and just, honey, information about life, honey, living la vida loca. All right. Well, now let's get into our weekly dose where I give you. Oh, yes.
Yeah, I'm going to pin a couple of links for the breast and cervical cancer screening for
Oh, good,
everyone,
good.
and then Stand for Her with the Susie G. Komen Foundation.
Very good. The CDC has a national breast and cervical diagnostic link where, especially if you're someone who is having trouble finding affordable screening or getting the information you need to be screened for breast cancer and cervical cancer, that's a service. So look for that link that Ms. Shador is pinning now. And then, yes, this other one, I love it. I believe the Komen Foundation arranges it. They are dedicated to finding out why there is such a gap, why Black women are 40% more trying to find out why Black women are 40% more likely to die from breast cancer when compared to white women and other ethnic groups. Why are we having more aggressive cancers? Why are we having cancers that are more difficult to treat, like the triple negative? And so make sure you check out these links and take care of your health, do your screening. And remember, 85% of women diagnosed with breast cancer had no family history. Okay, so get your screening, por favor. All right. All right, so check out those links. And now we'll move into our weekly dose. Let's start off with talking about body lice. I thought body lice was out of style, but my line sister, Eva Morgan, and I were talking, and there was a body lice outbreak on the University of Maryland campus. And it also happens to be my line sister's birthday. Happy birthday, E. Happy birthday, Eva. Okay, but we're having a conversation. And listen, just look, I did a short form content, plus my members only have the full video. Let's play this, and then we'll talk about body lice, and we'll talk about baths, the frequency of baths. And I'll go ahead and tell you, I'm gonna ask you this question. Put bath, B-A-T-H, in capital letters, and answer this question for me. If you want to, it's your personal business. But I want to know, do you think that taking baths daily is important? Or how frequently do you think people need to bathe? I'm so serious. And if you think washcloth, no washcloth is important, throw that in there too. I'm curious to see who I'm talking to. All right, let's play the body lice clip, and then we'll talk more about body lice.
Y'all need to take a bath or a shower, and you need to change your clothing. This is a public service announcement. There was a body lice outbreak at the University of Maryland, and it's primarily from poor hygiene, okay? And I used to wonder why Lumi, the body deodorant for your pits, privates, and more, I'm like, that deodorant lasts 72 hours, but who needs a 72-hour deodorant? And I talked to my line sister, and she's like, Frita, a lot of people don't bathe. Oh, my goodness. All right, so let's talk about body lice and how Lumi is not the answer. So recently at the University of Maryland, there was a body lice outbreak. There are 3 different types of lice, right? There's head lice, okay, body lice, and then pubic lice, also known as crabs, okay? They are different. So I'm talking about the body lice. Body lice are these little insects, okay? They're about the size of a sesame seed, and they live in your clothing and in the seams of clothing, and they crawl on your body several times a day in order to feed off of your blood. That's how.
Okay. So yes, honey, I was talking about body lice this weekend, and I just posted I went to the gym yesterday, and so I was on one and talking about hygiene because, listen, members, you'll see when y'all go and look at my video. It drives me crazy when I go to the gym early in the morning, as in early. I know y'all have not had time to run a marathon, but I walk in and folks don't have good hygiene, and that bothers me. Okay, because if you can afford the gym membership, you can afford soap and water. But in a more kind of pressing situation, the body lice is a reflection on how poor hygiene can actually be a health hazard. So yes, write bath in the chat, and I want you to tell me how important you think it is to take daily baths or frequent baths, and is it important to use a washcloth and just kind of get in there? Do you think it's a big deal, or do you think some folks are just being too clean? Well, let's talk about body lice and see what you think. So as I was mentioning, there are different types of human lice: the head lice, body lice, and pubic lice or crabs. Oh my gosh. Those are 3 different things. Human lice do not go to your pets, and your pet's lice, it does not come to humans. So if somebody's walking around with lice, they can't say, oh, I got this from my dog. No, you got it human to human. And the biggest risk factor for body lice is poor hygiene. In mid-September, University of Maryland put out an announcement that in at least two buildings, they found body lice. And this is what happens. So the body lice actually live in clothes and in the seams of clothing. And they travel to your body to feed off of your blood several times a day. That's how they live. Okay. And then they go back into your clothes and they live in the seams. If you are bathing with soap and water, then it's difficult for the body lice to live. Okay. So not bathing regularly is a huge risk factor for body lice. Also, if you change your clothes, if you put on clean clothes each day, it's hard for the lice to live, because for the adult body lice, if they go 1 to 2 days without a blood meal, they can't live. And so you're putting on clean, fresh clothes, and the body lice are somewhere else where there's no human, they're going to pass away in 1 to 2 days. But if you keep putting on the same clothes and you're not bathing and you're in your linens, then that's how the body lice will spread. We typically think of body lice in places where there's close contact of humans and if they don't have access to baths. And so refugees or people who are unhoused, okay, homeless people might be at higher risk. People who have a disaster, okay, if there's a hurricane, tornado, and they're away from their homes and they're in shelters and they are in close contact and they're not able to get to the baths daily. These are people we understand and we expect. They don't have the access and they're in close proximity. But when you look at a campus like these universities, and I know University of Maryland, that's the one in the news, but y'all know at some other college campuses, sometimes folks are not bathing. So University of Maryland, we know that those college kids have access to showers, okay? And so for there to be human body lice, these are humans who are spreading it. And so somebody in that population they're not bathing daily, possibly not weekly, and very likely not changing their clothes regularly. So here's what you do. Take a bath. Please, por favor, take a bath and make sure you stay clean. Also, change your clothes regularly. According to the CDC, they recommend that you change your linens and clothes at least once a week. I want you to do it every day, but the recommendation is at least once a week. And if you are changing clothes and linen, and especially if you suspect body lice, if you're not able to get to a washing machine right away, then seal the linen, seal the clothes in a plastic bag, tightly sealed, for at least 2 weeks, okay? The adult lice will die within 1 to 2 days, but the little nits, it'll take them longer. So put those away for 2 weeks. And when you do wash your clothes, make sure you wash them in hot water, at least 130 degrees Fahrenheit, and dry them on the hottest cycle. Okay, most people do pretty well with body lice once they, clean themselves. You can get some secondary infections. If you're scratching, you can get infections on your skin. They do carry some diseases. But here's what's really important. I mentioned Lumi, and that lady is a genius with her 72-hour deodorant, but I didn't know there was a need. I'm like, why would you need deodorant for 72 hours? But that's when, it's been brought to my attention that a lot of people don't bathe. And not to call her out, but my freshman year at Florida State University, go Knowles, I had a roommate. She didn't bathe every day. She didn't smell bad, but she literally bathed 3 times a week. And she wondered why I was bathing so much, several times a day, walking in that hot sun. When you come in from the sun, you take a bath, at least how I was raised. But it's just interesting how sometimes there are differences, sometimes cultural. But when it comes to health, we need to be on one accord. So while Lumi might last for 72 hours as far as keeping you smelling fresh, it does not get rid of body lice. So please don't think Lumi replaces baths. I will say I was looking on the Lumi page, and this is no shade to Lumi deodorant, but some people who are camping or people who are, post-op and aren't able to get into the bath like they want to. They were talking about how they use Lumi, things like that. But just please don't let it replace a bath if you are able-bodied and able to get there. All right, I'm curious about my med heads. Did anyone comment on baths? Do you think it's important to bathe regularly? Or what's the deal with the cleanliness? Is that no big deal? Are we doing too much over here?
Well, of course, the chat is on this today. Limitless Sky says daily.
I know that's right.
Okay. Jay says bathe at least once per day.
Okay, I know Miss Jetty. She bathes at least twice a day, but I know who raised her. And so, yes, we put it in at least on the once a day, but a lot of us do it more. And that's just what it is. Probably the more than once is not absolutely necessary, but daily. Now, if you bathe, every other day or once a week, can that be enough to limit body lice? Perhaps, but this is an opinion situation right now. So, honey, I'm with Jetty at least once a day. Okay.
All right. Sheree says bathe every day if you are going out among others or to work. If at home, at least 4 days a week or as needed.
Okay. And that probably, from a health perspective, is enough, to keep something like body lice away. And okay.
And she added that some people have skin issues like eczema. So, of course, they are advised by a dermatologist not to bathe every single day.
Well, now you bring out a point. Sometimes excessive hot water can be drying to the skin. And so you do want to consult with your dermatologist. But of course, there are other things you can do, even with eczema, if you're using steroid creams, although I know we like to limit the steroids that we use in our creams, or even just using like really thick hypoallergenic moisturizers to hold the moisture in. But that's a good point. If you have a dermatological condition, make sure you consult with your doctor. Okay, that's good. That's a great point.
All right. Miss Aileen says we should take showers daily, but it also depends on the activity level.
Okay, so if you took a shower one morning and then you go and you take a 3-mile jog, please take a shower before you go to bed. That's just, I don't know how much of that is a medical recommendation. That's just kind of a good hygiene recommendation. But for sure, I think that we can all agree that people need to be changing their clothes, putting on clean clothing, and not going over a week without bathing. From a health perspective, the CDC says at least once a week. So that's the evidence-based portion from a health perspective. I'm just asking y'all because I'm curious about what your habits are or your thoughts are. Okay. Anyone else?
Yes. Queen Gina says both. Yes, I do sometimes twice a day. Bathe or shower, and yes, I use rags that I change daily. So changing your washcloth out daily.
Yeah, because I've seen that on social media, a big thing about washcloths, and sometimes people will just apparently let water and soap run down. But I definitely was raised to use the washcloth because there's an exfoliation, and you can imagine, let's just say you have a body louse on you, they can kind of cling on and kind of attach to you because they are sucking your blood. That's how they're living. And then some water might run past them. They're only the size of a sesame seed. They're tiny. They might hang out, but you put a wash rag to them or a washcloth and scrub them off. I bet they'll go bye-bye. So that's not, to me, just a preference thing. It's a health thing. You're exfoliating your skin. Plus, if you have anything like lice or a tick or something like that, and make sure y'all get into all the crevices. There's a whole nother discussion on some men who don't like to wash themselves they don't like to wash their behinds. Some men, for certain reasons, they don't like anything to touch them on the anus. I'm not kidding. There's certain men who think that it's not macho to do that, but please, y'all, just wash yourselves and be clean. Because if you don't, and you have, let's just be blunt, feces and things around the anus because you don't think it's macho to clean yourself, that can lead to infection. It can spread. And then when you're intimate with other people, then you can mess them up. For example, men who are not cleaning themselves properly and they're intimate with women, where the women will be more likely to get urinary tract infections from that. Ooh, this conversation can go a whole lot of places. All right, do we have anyone else? And then we'll get into our next weekly.
I have a question. I don't know if we covered this or not. What are the signs of body lice?
So the signs of body lice. So they're pretty sneaky, these little tiny sesame side body lice. And so sometimes you won't feel them biting you, but you'll oftentimes get a reaction, like a histamine release, which might make you have some redness and some swelling. And so the bites tend to show up around the neck, in the underarms, or like at your waistline, at the seam of pants or skirts. And so you'll just get little tiny bites, like there might be a little red, a little erythematous, or just like little bumps, little papules. Now, if you're scratching, then you can get a secondary skin infection, like a bacterial skin infection. And then some of the lice even carry infections like typhus and trench fever and relapsing fever. That's less common, but it's possible. They sometimes will bring you infections with their bites. But yeah, mainly bites, typically around the neck, the underarms, around the waist. Because remember, they don't actually live on your skin. They live in the clothes and the seams of clothing. And so when they crawl to where they can meet your skin is oftentimes kind of where the edges of your clothes are. Yeah. Good question. Yeah.
All right. Thank you, Dr. Frita.
All right. So let's move on to our next weekly dose. Y'all are on fire today. I love it. Okay. Let's talk about Madonna. First of all, y'all need to understand that when I was a little girl, my daddy bought us Madonna's album, and he bought it from Kmart. Okay. And it was a record. Some of y'all young folks don't know what records are, but honey, I had me a record player. We had the real one in the entertainment room, but then I had my own, I think it was a Fisher Price one. I don't know. Jetty, did we share that record player? I don't know. But Madonna, I really enjoyed her with Material Girl and Papa Don't Preach and all kinds of things, you know, back in the day. Now I know she's had different controversies, but here's something that's not controversial. Madonna, who is now very grown, actually had sepsis, okay? She had sepsis, and now she's sharing her experience with the sepsis. So let's go ahead and watch that clip, and let's talk a little bit about sepsis.
A half ago, I was rehearsing for my tour, and I got a bacterial infection, and 1 minute I was alive and dancing around, and the next minute I was in the ICU unit of a hospital, and I woke up from being unconscious for 4 days. I got out of the hospital. They took me off of, the ventilator. I started to breathe on my own, and I had something. It's called sepsis, and it's like it can kill you.
Yeah, that's really bad. Yeah. And
everybody recovers at a different rate. And so, I've always seen myself as Superwoman. So I was like, oh, I'm gonna kick this. I'm gonna be good. I'm getting back into rehearsals, and I had no strength. I had no energy. I couldn't get out of bed, and I didn't know when it was going to end. And I used to talk to my teacher all the time, and he's like, the sooner you accept what's happening to you and that you don't know when it's going to end, the sooner it's going to end. That made so much sense to me. And of course it did.
All right. So she had sepsis. I don't know the details. And so we'll talk about just in general, the definition of sepsis and the difference between sepsis and septic shock. But I want you all to put in the chat and put sepsis in capital letters, SEPSIS. What do you think some ways are to prevent sepsis? What are some ways to prevent sepsis? Okay, put sepsis in the chat. What are some ways to prevent sepsis? Okay, so what is sepsis? Sepsis is your body's reaction to an infection, but it's actually an abnormal reaction. And instead of your body just fighting the infection, it actually causes some dysfunction with your own organs. And so if you have sepsis, it's like an abnormal inflammatory response of your body. And so it can be from many sources. A urinary tract infection can lead into sepsis. You can get a little cut or a skin infection that can lead your body to have a really hyper inflammatory reaction that can lead to sepsis. Having pneumonia that starts off just in the lungs can lead into a full body sepsis reaction. And so with the sepsis, some of the signs and symptoms, you might have a very rapid heart rate. You can have a fever, so a high temperature, or you can have hypothermia, low temperature. You might get shallow breathing. You might develop diaphoresis or really excessive sweating. You can get some confusion, okay, and altered mental status. All of these things can happen with sepsis. So what is the difference between sepsis and septic shock? Well, sepsis is something that can be treated with like antimicrobials, okay, like antibiotics, and oftentimes with IV fluids. But if you get septic shock, that's when you've tipped over into a more serious complication where you get very low blood pressure, okay? Blood pressure that's so low that simple IV fluids aren't enough to get it up. And so you need an ICU stay, okay, intensive care unit. And you often need medications that will artificially keep your blood pressure up, vasopressors. With septic shock, it can often lead to multi-organ failure, okay? So respiratory failure, where you need to have a breathing tube down your throat, okay, be on a respirator or a ventilator. You can have kidney failure, where you go from having normal kidney function until you need dialysis and you need me to come and dialyze you. So you can get multi-organ failure, liver failure, cardiovascular collapse, all of that. So septic shock is that next level, okay, with the low blood pressure and often multi-organ failure. So there are some ways to prevent sepsis. And so we'll talk about those because we know that sepsis starts out with infection, right? So whether it's bacterial infection, fungal infection, viral infection, it starts off with infection. So to anyone put in the chat, these little know-it-all med heads, anyone put in the chat some ways they think you might be able to prevent sepsis?
Yes, from IG, the NP Anika. Hello.
Oh, hey, welcome back. Okay, what you say, the NP Anika?
She says, don't wait the symptoms out of an infection. Get seen and get treated for your infections.
Absolutely. So start when it's local, right? So I'm just saying how, it might start with the urinary tract infection. So don't sit there and wait until you have low blood pressure, you're sweating, you are confused. If you know that you're having symptoms of a urinary tract infection, like dysuria or pain when you urinate, cloudy urine, foul smelling urine, a change in the color of the urine, if you're having those symptoms, then yes, go ahead and consult with your doctor and get treated with whatever antibacterial, antibiotics, antimicrobials, then. So good, early detection. Same thing with pneumonia. If you know good and well that you are short of breath and you might start to have a slight fever, don't wait until now the infection has gone from your lungs to all over your body and you're reacting and you have low blood pressure and you really can't breathe and you need oxygen and you need to be intubated. Go as soon as you know that something's different. You do know your body, so listen to it and consult with your doctor. So that's very good. Catch it early. Catch the infection early. Good.
All right. I remember Miss Rosalind.
Hi, thank you for being a member, Miss Rosalind. Welcome back.
Sepsis can occur after some surgical wounds.
Okay, so then good wound care, right? So making sure that if you're supposed to be getting the dressings changed regularly, do it. If you're supposed to irrigate the dressing, or just whatever instructions you've been given surgically, follow that. So yes. Another thing after a surgery, sometimes if you're just lying in the bed too much and you're not up moving around, you can get atelectasis or like collapsed lungs, and you can even get a predisposition to getting pneumonia. So making sure that you follow your post-op care, the wound care, as well as the physical therapy and what you're supposed to do physically. That's another way to prevent. Good. Okay.
All right. T Chosen says good hygiene, or good body hygiene.
Thank you, T Chosen One. Have good hygiene, like we've been talking about. So make sure you clean all the cracks and the crevices in your body and in your mouth, okay? Make sure you brush your teeth regularly. Go get your dental checkups, get your teeth cleaned, your deep teeth cleaning, because having tooth infections is not just about, having a yuck mouth because you don't brush. Do y'all remember that? Tell my age. Anyway, but having like tooth decay, dental caries can lead to dental abscesses, which can also lead to sepsis. Okay, it can even lead to having an abscess in your brain. So yes, good hygiene is a good way. Let's take one or two more, and then we'll move on.
All right, Jetty. She says you can go to the emergency room when you get a major burn.
That's a very good point, Miss Jetty. Having a burn, so your skin. That's your largest organ. Your largest organ is your skin. And it's also one of the most important barriers to infection. If you have a burn and you compromise the skin, then that can put you at increased risk for infection. Okay, so paying attention to and respecting burns. Very good. When I was doing my training, when I did nephrology fellowship at Emory University Hospital School of Medicine, my first year of fellowship, I did a lot of work at Grady Hospital. That's where the Emory fellows would go. And we had a great burn unit. I'm talking about, we took really great care of patients at Grady, but almost all of the ones who were there in the burn unit with severe burns had overwhelming infection due to the burns and their compromised protection from infection. So good. Okay.
And Miss Stephanie.
Hi, Miss Stephanie.
To wash hands frequently and treat STDs to prevent PID.
Listen, don't even play with it. Thank you. Good point. So yes, definitely frequent hand washing. And so we'll talk about that because we're going to talk about the Listeria as well, real briefly, but also, yeah, for people, I was about to say young people, just because there tends to be a high prevalence in young people. But if you have, discharge from your genitals, itching, bumps, even if you have a painless chancre, like with syphilis, don't ignore it. Because if you have like chlamydia, gonorrhea, sometimes you might not have symptoms. Okay, so you got to pay attention to discharge, but it can lead to pelvic inflammatory disease, and it can lead to sepsis and things that will take you out of this world. So yes, pay attention to your body. Have no shame. I'm glad you brought up that point. Okay, good. All right. All right, so that's a good one. Okay, so hopefully Madonna's doing well. We know she has all the resources, but I do appreciate her for coming forth and for sharing it. So now we are going to talk about Abbott, Abbott Elementary. Okay, y'all, that show cracks me up. But let's talk about one of its stars, Tyler James Williams, who was diagnosed with Crohn's disease. He shared that before. He even shared that he has a brother who was diagnosed. And so we'll talk about Crohn's disease and kind of some signs and symptoms, some ways to recognize it. In fact, just put in the chat, please, put Crohn's and then put some signs and symptoms of Crohn's. Let's play this clip and then we'll move through.
Says once he learned he needed to live with Crohn's disease, he went after more purpose-driven roles like Gregory Eddy on Abbott Elementary.
Imagining the worst thing that could possibly happen is one of my best qualities.
This morning, Tyler James Williams, fresh off his Golden Globe win for his role as Gregory Eddy on Abbott Elementary, is sharing his story of living with Crohn's disease.
For stories like his, that we may understand that his story is just as important as all of the other stories.
The actor telling Men's Health magazine that efforts to put on muscle weight for TV roles in his early 20s revealed the disease, one that nearly threatened his life, saying, "I was really pushing my body to the limit. By the time December hit, it just crashed. Everything shut down." Williams reportedly undergoing emergency surgery to remove 6 inches of his lower intestine, but his intestines unable to heal back together, sending him into septic shock, saying, "The last thought I had was this could be it." More than 500,000 Americans are living with Crohn's disease, an inflammatory condition in the digestive tract that can lead to abdominal pain, weight loss, and malnutrition.
Yeah. And I watched him in Abbott Elementary. I watched him in other shows. What was that? Everybody Hates Chris. And he's, really a talented actor. He's very funny and kind of the straight man in Abbott Elementary. And I've watched, before I knew he had that diagnosis, I've watched his size change. And sometimes he looks very thin, even a bit malnourished. Because y'all know when I'm looking at TV shows, I've been looking from a medical eye. And so when I learned that he had Crohn's disease, I was like, okay, that makes sense, because we know that Crohn's disease is an autoimmune disorder. And you recall that when we're talking about autoimmune disorders, that means that instead of your antibodies, your immune system just fighting bacteria, viruses, and germs, it turns on you and starts to fight your body. Okay. And it can fight any system. Like with lupus, it can fight your skin, it can fight your joints. With sarcoidosis, like what Bernie Mac had, it can fight your lungs. With Crohn's disease, it fights typically your small and large intestine, but can really affect anywhere in the body. And so Crohn's is an autoimmune disease. And for Crohn's disease, again, it typically attacks the small intestine, the large intestine, but it can cause mouth sores all the way down to causing anal fistulas. Okay. It can even increase your risk for liver disease, increase your risk for kidney stones for different reasons, because it affects the way that you absorb things like oxalate and calcium. But it can definitely cause you to have malnutrition, difficulty gaining weight. It can cause you to have fistulas or connections inside of your abdomen. For example, if you have, let's put up that, did you get a picture of the Crohn's? Yeah, let's do that. So you see in a normal intestine versus an intestine with Crohn's disease. With the Crohn's disease, like as you get inflammation, then the fat in your abdomen, your omentum might wrap around it. You tend to get inflammation throughout the whole wall of the colon. And you can even get fistulas, meaning a connection between the intestine and outside organ. So you might end up with a connection between your intestine and your bladder. Okay. And patients will show up and they'll be urinating brown urine because of what's coming out of the intestine. Okay. Or you might have a connection between your intestines and another organ. All right. So it can really be complicated, and all the inflammation can sometimes cause obstruction. It can cause the inside of the intestines to stick together. So you can imagine trying to be an actor and, like he shared, trying to gain weight, not being able to put on muscle mass, being fatigued, all of these things from Crohn's. So let's real quickly see if anyone commented on some of the symptoms of Crohn's disease. Any takers? All right, little smarty pants.
T Chosen.
Okay, how T Chosen one?
T Chosen says fatigue and anemia.
Absolutely, fatigue and anemia, very good. Especially if you end up getting, GI bleed, okay, or bleeding from the inflammation in the intestines. Good.
All right.
Okay.
Oh, Donna Michi, hello.
Hello,
Says
Donna
loss,
Michi. Nurse Donna Michi. What else?
weight loss.
Weight loss. Okay. And we've seen it in him, right? We've seen it in even his character on Abbott Elementary. He's quite thin. He's quite thin. And of course, a lot of men folks in Hollywood are thin on purpose, but sometimes his weight will go up and down. And it sounds like it could be, depending on how much inflammation he has. Very good.
Sheree added bloating and diarrhea.
Yes. Ooh, and Sheree, you can get diarrhea or constipation. You can imagine if you've got some obstruction or blockage, it could slow down, okay, the way that your bowels are moving, and you can end up having really dry stools and constipation. And you can also get diarrhea. You can also get bloody stools. Real good.
Donna Michi added pain.
Pain, severe debilitating abdominal pain. And you can also, I mentioned like those fistulas, you can get anal fistulas where there are literally connections coming out around your anus, and they can get infected and it can be severely painful. Okay. You can get perirectal abscesses. You can get all these things with Crohn's, mouth sores, and believe it or not, you can get joint pain. Okay. Sometimes the antibodies don't just attack the intestines or the digestive system. They'll just do what they want to do. And you can get joint pain related to Crohn's. It's really not a kind disease. But even though there's no absolute cure, we do have different treatments now. So just make sure you consult with your doctor. Real good. Okay. All right. Now, I want to talk about this. Make sure you, again, follow me on all social media platforms at Dr.Frita, because I did some short form content on this next topic. And for my members only, I give you the full videos, like 11 or 12 minutes versus this little short form that I have for my non-members. So basically, I just want y'all to go look in your refrigerators. Just go on and look right now or after this live, because there's been a Listeria outbreak. Okay, that's a bacterium, Listeria monocytogenes. And basically, it's been found starting in June. They started finding cases, but as of the end of September, 4 people have passed away from this Listeria outbreak, and 1 lady miscarried. Okay, she lost her baby, which is significant because we know that people who are pregnant are at a high risk of Listeria because it can cross the placenta and it can cause fetal loss, which it did in this 1 lady from this outbreak. And so if you are pregnant, if you're over the age of 65, if you're immunocompromised, that puts you at a higher risk for Listeria. And get this, the Listeria is something that if you're drinking unpasteurized milk, you can be at higher risk for it. If you eat soft cheeses like brie, blue cheese, then you could be at high risk for it. And it can be on vegetables also, because Listeria is found in soil and in water. And so it's recommended that you wash your vegetables, honey, use a vegetable scrubber and everything. But if you get Listeria, the symptoms will show up in 2 weeks to even 2 months. And that can be fever, diarrhea, stiff neck, headache, because you can get a bacterial meningitis from the Listeria, which is an inflammation of the coverings of the brain and the spinal cord. Now hear this. Let me tell you where this outbreak is. It's been found in foods from Walmart, Trader Joe's, Albertsons, Kroger, and it's mostly been in ready-to-eat meals like pasta dishes. So like the ready-to-eat Cajun style blackened chicken fettuccine Alfredo from Trader Joe's. There's another thing from Walmart where there was a linguine with beef meatballs and marinara sauce. So go to the FDA website, okay, or you can just Google Listeria outbreak recalls, and there are lists of very specific lot numbers, expiration dates. But if you eat any of these foods, like these ready-to-eat pasta dishes from any of the places I mentioned, make sure that you don't have anything or that you haven't eaten anything. And if you do, pay attention to symptoms and consult with your doctor. Here's the other little thing about Listeria, because this is an old freaky bacterium. Listeria can survive some refrigeration, and then sometimes it can even survive being in the freezer. Okay, so just because your item is in the freezer, don't think that you're good. Listeria can survive a whole lot of things, but it is recommended that you store your foods in a very cold refrigerator, like less than 40 degrees, in order to try to prevent the Listeria infection. Okay, so make sure you check me out, all social media platforms. I have the short form content, and members only, y'all get the extended version, because y'all know I always have a lot to say. All right, let's see. Shall we end with a bit of a feel-good story?
Why not?
Why not? Terry Crews, y'all know he's known. He's an actor and he's known for being in shape. Do y'all know this man? This man he exercises every single day. He's like bump rest days. He exercises every single day. And so I want to know from you in the chat, and put Cruz. How you spell his name? Cruz. Put Cruz in the chat. And then tell me if you think that it's important to exercise every single day, or do you think that's important to have rest days and have some type of a moderation. Anyway, let's play this clip and I'm gonna see what y'all have to say about it.
Claims he never skips a workout? Not even once? No. At the AGT finale, he revealed that no matter how crazy life gets, he always hits the gym. Every morning, he snaps a workout photo to keep himself accountable. And he swears by one rule: discipline isn't punishment, it's training. Some fans are inspired. Others say it's impossible to go without rest days. But one thing's clear: Terry Cruz's dedication is next level. So, do you believe it's possible to truly never miss a workout? Or is Terry just building the myth? Let me know in the comments.
All right, so that's my same question. Do you think it's possible to really go without missing a workout? I definitely believe him. Y'all see him in all of his movies. He is fit. Now it's also his life, of course, for health, but it's also his life and his career is largely based on his body. But I did kind of like what he said as far as the discipline is not punishment, it's training. Okay, so this is something he's chosen to do for himself. I know some people have kind of all or nothing personalities. If they don't go and do something all the way, then they won't do it at all. And I don't know if that's really a healthy habit, but what say you in the chat?
EMP Anika says that very important to screen for others. Excuse me. Miss Anika, this concerning the she might be catching up on our live. I'm sorry. But T Chosen did say rest and recovery needed for exercising.
Yeah, but I'm sure he's probably, doing upper body some days and resting, and then the lower body. His is extreme. It seems to work for him, but it is recommended to have rest and recovery. And according to the American Heart Association, it's recommended that most adults exercise for 150 minutes a week. So that's like 30 minutes a day, 5 days a week. Yeah, I like a little bit of rest and recovery. And y'all make sure you give us a like, please. Please give us a thumbs up as we give you this evidence-based information, and make sure you share our video. And for the people who are in the replay crew, please give us a like and please share as well. It is a free way to support the channel. All right. Anyone else comment? Do we have any folks who exercise every single day?
She says moderation with rest.
Moderation with rest. I agree. Because you can get burnout. Again, not knocking him because it works for him. But the reason I think that he is a big story is because he's not the norm. Yeah, getting the exercise in moderation. Yeah.
Yep. Lisa. Hello, Lisa. Lisa says depends on the regimen, cardio, stretching, etc.
Oh, I see what you're saying. So maybe do something intense like HIIT training, cardio, do something intense. But even on days where you're not as intense, maybe always getting a little stretching in every day, always getting a little yoga, deep breathing, Tai Chi in every day. Okay, even then, there's still some moderation in what you're describing. But that makes sense, moving your body in some way every day, a little light walking every day. Yeah. Okay.
Yeah. And JD said needs at least one rest day.
At least one rest day. I'd be taking more than one rest day. But yeah, but as far as American Heart Association, getting at least 150 minutes of moderate exercise is what's recommended for cardiovascular health. I certainly commend him. I know everyone can't do what he does, but just for us, the med heads, for everyone, the replay crew, IG, Facebook, all of you, just understand that if you're taking rest days, if you're exercising in moderation, as long as you're getting enough exercise to promote good cardiovascular health, healthy weight, that's going to be something that's good. And yeah.
Rainy Girl on IG said it seems to be addictive when men and women get that pumped up.
Yes, and I know I've had in my younger days times where you're almost addicted to working out, and just when you start seeing your body change, and then when people start saying, "Ooh, you're looking good in your clothes," or "Ooh, you're looking good on the beach," it can be addictive. It can be. But it can have pros and cons. Definitely, overall, the exercising is something that's good for your physical and mental health. Make sure you check out my video, Top 10 Exercises to Lower Blood Pressure the Natural Way, right here on the Dr. Frita YouTube channel. After you finish watching this live, check out that video. Very good. I do want to do a little jump back. I know you mentioned an MP Anika comment. That was a jump back for more prevention of sepsis. We mentioned a lot of ones, but vaccines also. Getting vaccinated for preventable disease is another way to help to prevent infection and sepsis. So make sure you consult with your doctor about the vaccines that are recommended for you. Yeah. All right. Any comments from members or any questions as we get ready to slide to the left? Make sure y'all give us a like. Give us a like before you go, please.
Dre has a question about the Listeria.
Okay.
She says some of these foods have to be microwaved or heated up before eating. Doesn't heat kill Listeria?
Heat typically does kill, but clearly in some of these situations when the infection of Listeria, once you have a Listeria contamination, it's difficult to know just how much the Listeria has multiplied. Okay. So for example, if you happen to look in your freezer or refrigerator and you see one of these ready to eat pasta meals that had a lot number or expiration date that matches, I would not even heat it up to try to kill the Listeria, because you don't know if there's an overwhelming amount of Listeria that has multiplied to the point where even heating up won't be sufficient to kill. You know that companies like their money, they don't part with money. When you do a recall, it's very expensive. So by the time they call for a recall, I recommend that you listen to it. So yes, in general, you would think that Listeria can kill. I mean, it can be, killed in the microwave or by heating. But if there's an overwhelming multiplication, a high bacterial load, I wouldn't even fool around with it. So make sure you check the FDA website, even the CDC website. Just Google Listeria outbreak food recalls, and you'll see the very specific lot numbers, expiration dates, and they break it down by store. They do a very good job on that FDA website. Yeah, that's a good question.
Yep, absolutely.
All right.
Yeah.
That's it. All right. Well, thank you so much for joining us, MedHeads. Thank you to my members. Thank you to everyone who subscribes. Like I said, we're up to over 900,000 subscribers. And so y'all know, next stop, 1 million. We're headed to 1 million. Make sure you follow me on all social media platforms at Dr.Frita. I do give you different content. And right now on my TikTok, You Don't Stop, I'm doing medical mornings at 8:30 a.m. on Wednesday. So come join me, and you can come on stage live to ask me some questions. And so also make sure you check out my website, my one-stop shop, drfrita.com, and get my book, Under Pressure, A Guide to Controlling High Blood Pressure. We talk about natural ways to lower blood pressure in addition to medicine, honey. We do things in an integrative fashion. And of course, we talked about the telehealth concierge service, where I can talk to you from anywhere in the world, one-on-one, about your medical issue. All right. I appreciate y'all for joining. I will see you next week. Same bat time, same bat place. And thank you for making Monday your healthiest day of the week.